So this is delivery AE77, A.McGlynn, not that you guys need to know that. So I have to introduce myself. So this is the second presentation that follows on from the first one that I did on aseptic technique. So this is actually using aseptic technique to actually prepare a sterile field ready to insert intravenous cannulas. So we all know that cannulas go into veins. We want to keep it nice and clean. Last time we did the whole process of setting up as an aseptic technique because there is a bit of a trick to it. And some people hadn't really done it before. Housekeeping, toilets, fire exit, etc. Learning objectives we're going to cover, aseptic technique we'll cover. I've got a small PowerPoint presentation compared to last time. Demonstration, practical activity obviously again to have a go at it, and then just going forward. So fire, out the door, we all know the process. What's said in the room stays in the room, so don't feel like you can't say something that you think is stupid. Nothing is ever stupid. COVID, we're all sitting reasonably far away from each other, and masks are on, off. At this point, we're all COVID negative, so I'm fine. Toilets, around the corner. Work health and safety. So the only thing with work health and safety in this particular thing is the sharps at the bottom. Just remember we're dealing with cannulas and they are sharps. Okay, so please don't stab yourself. And just respecting anyone from different cultures in the room. So we're going to review the definition of what an aseptic technique is from last session. We're going to look at your guys' scope of practices. We're going to talk about the types of aseptic. We're going to talk about what cannulation is. We're going to talk about the selection of what equipment you need to do it. Correct patient preparation, which includes your consent, the patient's consent I should say, not yours, but you gaining the consent from the patient. And infection control procedures, as well as the demonstration of the aseptic field ready. So, aseptic technique that we covered last time, as it says there, is a procedure that we use to prevent the spread of infection. We use it to prevent microorganisms on hands, surfaces, equipment from being introduced into susceptible sites. So if we're putting something into someone and putting a hole, that's a susceptible site. So we want to minimise the risk of infection. So my first fun practical activity is going through what we did last time with our general guideline, which was just that quick flick sheet of what we do when we're setting up. Did anyone want to volunteer to actually do it on the trolley as us as a class talk you through the procedure?
Definitely. Registered nurse. Yeah. Vincent.
No one? Come on, just give it a go. Rightio, good on you, Karen. So what we're going to do is go around the room. Each one of us are going to talk Karen through the procedure of, we're on here? Yeah. And that's your pack when you're ready.
Oh, sugar.
So we're going to talk Karen through the procedure by using a step-by-step instruction. Correct. So just remember, when we're doing procedures, we're always doing them next to the patient or as close to the patient as you can. Obviously in this situation there's no patient, so we're just having a crack at it. And we always gain consent from the patient before we start. So,
Do you want a patient?
not really, not today. So the first thing that I'm going to start with, number one, is we're going to perform the risk assessment and identify what type of aseptic field we're going to require. So we want a cannula, which is just an aseptic technique. So we've decided that we want the aseptic field. The second step is Lyle.
Review the procedure. Absolutely necessary at this time.
Do we need to do the procedure? Yes, we do. Next.
Identify and gather equipment for procedure. Are they the most appropriate for the task? Check integrity of the pack.
Okay, so we're only going to do the aseptic field this time, so all you need is your dressing pack.
Oh, okay.
Okay, so you've got your field and you're going to check it for its integrity.
Okay. It's
Looking for
closed.
any broken bits. Obviously sometimes when we're opening packages we get a bit keen when we open the boxes and stab through packaging, so just be wary, sometimes the packaging may have holes or discoloration. Okay,
perform hand hygiene.
Thank you. It's usually on the trolley, isn't it? Is it or no? Like,
No,
can
not
you-
always,
no?
yeah.
Clean designated procedure trolley with neutral detergent, ensure workspace is safe and sharps
So
container.
you can use the hand rub again,
Available
Dom.
if required.
Just use the hand rub again if you like, because I didn't bring any of the other one today.
So look, I don't know, I learned this goodness, but that shouldn't be there. Start from the bottom and work your way up, is that, or from the top and work
From the
your
top
way
and work your
down?
way down.
Start
Always-
from the middle,
Yeah,
or these first?
completely up to you. So just
Remember that
remember,
will talk, the minute
Yeah.
we move out.
Yeah.
when you're cleaning the trolley, you've got to remember, and it's very important, that all those little bars on the sides have to be sterile as well. So it's not just the top that you're cleaning. It's also good to go down the legs. And if you're going to use the bottom of the trolley to stock any of your things, it should be cleaned as well. We don't normally use dog tags on trolleys. You should use tape, but the bag I've got won't stick with tape today. Because they just carry infection, those dog clips. So Karen's thoroughly cleaning her trolley with the appropriate cleaning product. And then she's going to throw that in the bin. So next,
We are going to perform hand hygiene.
keeping in mind that we're bare below the elbows at work. Okay, next.
And then, I'm ready for John. Open your sterile dressing pack.
So, I'm gonna, oh, and that's not what you do. You don't drop it on the floor to
It always
make
does
it
it when you're
dirtier.
demonstrating. Something
It
always
is,
happens.
in front of
I think I tripped over the cable last time, so.
So I'm going like this. Is someone meant to, are you meant to be telling me how to do it? Or
You're doing an
Telling
excellent
you the
job.
steps. So your
When
job
you
is
chip
to
if you're
now.
doing something wrong.
And there should be a garbage bag there too that I'm putting
I
all
like
this
the chuck
rubbish
on
in.
the floor.
Is this mine?
Yeah.
Just add sterile items as required to the centre of the field.
Okay, so she's going to open her sterile field to start with. Now, remembering that those little dressing packs have the little tag on them
They
these
know,
days, so
yeah.
you can pull the tag. And then you're going to get the corners to fold that pack out. Remembering not to touch the inside white side, that is your sterile field at this point.
The tabs I can, Amanda?
Yeah, the tabs you can.
I'm not used to tabs, so this is
Then
all
you-
new.
I think it's a great new thing on
Never
on a-
touching the thing. Unless they're folded under like that, of course, guys,
Sorry.
and that's not. Okay.
That's right, just checking that it, not press the button.
Okay, so Karen's got her sterile field. At this point, to do cannulation, we would add anything into that we need. But today we're not doing that. Yeah, well, we will
Add
later.
sterile items as required.
My cannula, the water, the 10 ml syringe for the flush,
Stepping way on ahead.
these ones, those
All over
ones.
it.
All of those.
You've done your package.
Then perform procedural hand hygiene again. Puts on gloves, PPE if
Yeah.
required.
I've only got one glove.
That's
Can we
okay.
just pretend
No,
I
this-
gloves on?
So the next step is actually preparing your patient. Getting the patient ready, their position, the comfort, where you need to do it, all those sorts of things. Remembering the procedure that you're going to do, whether it be a dressing, whether it be a cannula, whatever the case, you've got to prepare the patient in the best possible way. Then you're actually going to perform the procedure. So this is where we will move on once we start this particular thing. But at the moment, we're just recapping what we did last session. So now you've done your procedure, you've cleaned, you've wiped. Now you've actually got to tidy up after yourself, which 90% of the doctors don't. So you'll be tidying up after them as well. So the first thing you'll do, so I'm going to jump down to point 12 and go, you're going to remove your gloves, your PPE, you're going to perform hand hygiene. So you're going to take everything off. Yep. And now if you had to do anything, as in setting up pumps, putting on vac dressings, all those, turning things on, you do that then, when your hands are clean. Then you're going to do your hand hygiene again. And after that, you're going to clean your trolley and your rubbish.
hands.
Yes, the cleanest hands I've ever seen.
Then you're going to obviously clean off your trolley, and then when you've finished, you should always wipe your trolley down again. That doesn't mean next person who comes to the trolley presumes that the last mate washed the trolley. It's not always the case. Plus, I noticed when you were cleaning that one today, there was quite a lot of dust sitting on the top. Interesting when they sit for a while. But that's pretty much the basic of how we undo our aseptic field to create that aseptic field. So today we're going to take that one step further on how to then add everything into that field, which is aseptic for cannulation. Now, does that make sense? I know sometimes we get a bit carried away with cannulation not being kept as an aseptic procedure, but just remember it actually is a clean aseptic procedure. Okay. Sorry about that. Okay, Karen, do you want to have a seat?
Yes.
Thanks, Dom. Great job. You obviously listened last time.
And I do cannulas the right way.
So the general guidelines when you're performing aseptic technique is making sure that you're going to use the right field, the right aseptic field. So the aseptic field that we use basically in general nursing is mostly aseptic and a clean procedure. We can't do a sterile field, a complete sterile field, unless we're in a theatre. It's just not a practical thing to expect. We always talk about whether the procedure is necessary. Do they actually need a cannula in for fluids, or can we give them some oral hydration to try that first? Do they need what we're actually going to do? Does that dressing need doing today? Could I let it leave another day if it's got something on it that's worth it? Gather in your products before you start so you don't have to make 50 tracks back to the storeroom because you forgot something. Make sure you've got everything before you start. Doing your hand hygiene. As you see in the steps, there's like 3 or 4 different times that you actually wash your hands before you get to the patient. Because every time you touch something, there's that open for some sort of germ to get on your hand. Cleaning the trolley, hand hygiene. Opening the packet, and today we'll look at a different packet for cannulation that is still a sterile field that is now being used, which should be used more than a dressing pack. Obviously, any additional items, you're going to wash your hands, you're going to actually do the procedure. Get rid of your gloves, set appropriate things as we talked about, hand hygiene, disposing of your waste appropriately. Now in this particular thing, the biggest thing is the sharps. Sharps don't go in a normal bin, they go in a sharps bin. So we should never see cannulas in with general waste, obviously. And your trolley surface at the end. So what's your scope of practice in the job that you do? Well, what is a scope of practice?
My scope of practice, well, I'm able to perform cannulas because I'm trained in it, but it's also done under the guidance of the medical officer.
So a set of rules, Amanda, basically of what we have to abide by and around.
Yeah.
See how you said, do we need to do the procedure, right? Because 9 times out of 10, you've got to have the conversation with the doctor,
Correct.
Yes.
right? Because there are some people going home.
So there has been periods of time, and you as a staff member have the right to raise the issue of, do I really need to do this? And if you're not happy that it's something you need to do, then you have the right to say no. Some people don't need cannulas in to have fluids. They can be orally hydrated. So there is the fact that you can actually say, I'm not happy, can we have a further discussion? Can we try this first? Obviously, if they're going to want it, they're going to want it. But, you know, realistically, we should always be questioning what we do. We should never just do something because someone told us to do it. We should understand the reason behind it, and we should understand the reason why we're doing it. So basically, your scope of practice is what you are deemed competent to do. So what you have been assessed to do, that you're competent, what you're satisfactorily able to do, whether you have to do it under supervision, whether you need to do it with someone like this, and that every single person in this room will have a different scope of practice. As long as you work within your scope of practice, that is the main thing that you need to do. Types of aseptic technique we just did cover a minute ago. So there's the clean, just getting rid of general rubbish off the table.
Sorry, is he cutting the cheese?
That's okay. You've got your aseptic, which is setting up your sterile field. Then you've got your complete sterile field, which is your theatres and pharmacies and things like that, where things need to be when they're mixing up their chemicals. And understanding it. Your standard aseptic is just what we've talked about, and the surgical ones are very long. They're a very long procedure. There's all those scrubbing in, there's all those, so it's a completely different thing. And that's why a lot of the things we do are not called sterile, they're just called aseptic, because you cannot do that in an environment. Aseptic technique really is relatively simple. If you look at aseptic compared to sterile, you scrub your hands for how long to go to theatre, you wash your hands for the general rule. There's a very big difference. It's short, like I said. 2 key sites really. It's sort of like wounds or insertion sites basically. So wounds that you dress, redress, whatever, and insertions of certain things, whether they be art lines, pick lines, all those sorts of things. Very few things. General aseptic fields, non-sterile gloves, so you don't actually have to wear sterile gloves. Even though we say we're doing central lines and chest tubes in ED here, and we say that's a sterile field, you actually watch how sterile that field is when you see it being done. In an emergency department, very hard to do. You can try to the maximum, and you'll find that most people will have antibiotics after those sorts of procedures anyway as a prophylactic. And your non-touch technique that we learned last time, the clean hand, the dirty hand, so that you're not cross-contaminating what you're touching. All right, so cannulation, and you've all done your packages, is that a device is placed in the vein, which allows access into the venous system. It can then deliver drugs and fluids and blood components and all those things to patients. So it's something that is stuck into a part of the body of a patient. So you've broken your natural barrier, which is your skin. Natural barrier for infection is your skin. You've just broken it by sticking a hole in it. Therefore, increasing the risk of infection with a germ. Selection of your equipment is very important, making sure that you're getting the right equipment before you go to the patient, of course. So the trolley, whether it be an IV trolley, whether it be a dressing trolley, whatever you use, you've got to make sure you've got that. Now, the cannulation packs these days are your little white seal packs that you've all got in front of you. These packets came out, I don't know, probably a couple of years ago. And I don't think they're probably used as much as what they should be. But these are basically your sterile dressing pack. Same thing, except it contains stuff that you need for your cannulas. Not all of it though, so learn what's in it. So you've got your dressing pack. So if there is none of these, realistically you should be setting up for cannulation on a dressing pack to get your sterile field.
Okay.
Not just on the bedside of the patient or the linen on the bed or on the patient, okay? And you see it done all the time.
Yeah.
PPE and gloves if you're required, so obviously we're sticking things and we're going for blood, so use gloves. Tourniquet, single use. Now I didn't bring a lot of those today because they're fairly scarce and
Didn't these used to have?
they used to have,
Yeah.
yeah.
Nobody ever used it because they weren't very good.
So I didn't bring any tourniquets today because there's not many around. We're on a fairly scarce, but you all know what a tourniquet is and how to apply that. Your skin prep swab is in here. So we used to get the swabs, they're in here. The next thing you want to do is actually select the appropriate cannula size. So, cannula sizes, the less the number, the bigger the hole. The higher the number, the smaller the hole. Completely opposite to what you would think. Yeah. So I picked some quite small ones today because they're not something that we use all the time, so we have a fair abundance of stock. Remembering going back to why do you need it will help you work out what size you need.
Can we
Not
stick
always.
pencil with a 16 gauge?
I was going to say veins.
Correct.
The
So you're
size
going to
of
look at
veins.
one, what do you need it for? Do you need it for fluids? Do you need it for nasty antibiotics that are nasty on your veins? Do you need it to get lots of blood in or lots of fluids in quickly?
So,
Do they have the worst veins in the world and you're not going to get it?
so for trauma in ED, what size? 16?
You should be going to 16 and 18.
And the same with in maternity.
Maternity, correct. Because they've got that potential for such big blood loss, where you're going to have to get big volumes of things in quickly. So you think about a size 24 that's in your hand now, and you think, how am I going to force a massive amount of blood through that tiny little hole at the end? It's not going to work, right? So that's why you need the biggest ones you can. So you need to go back to that, selecting the right equipment, looking at the patient, what do I need it for? And that will give you, so sometimes I will go to the patient with a couple of different sizes, just because I'm not sure. Rather than running out every 5 seconds to get one, I might go with a couple of sizes, working out what I want them for. The cannula bung, safe site, is another thing you need. That doesn't come in the pack. The dressing, however, does. The transparent dressing is inside. You don't need to have that. Your 10 ml syringe is not inside. You need one of those.
So we're not come from any problem.
And your ampoule normal saline's not in there. And neither is your sharps container, obviously. But it will be on your trolley.
All this.
Or if you miss, you know.
I'm used to
So
this.
we need the pressure dot in case we miss and we have to stick the dressing over the hole we just made that failed. Okay, so we've talked through what we need. Now we need to go and sort of, you know, get the patient's consent. Hey mate, can I put a cannula in the arm? They're like, no way. So you actually need consent. I know that we go to patients all the time, but you know, you should really be saying, you know, am I able to put a cannula in? Otherwise it can be called a lot of other things. It has to be freely given. Normally when you're talking to them, you're saying you need this in so I can take some blood off, or we're going to give you some fluids, or you need some antibiotics. So you're giving them the specific procedure, like what you're going to do with it. And just informing them of risks, things like the risk of infection, all those sorts of things. So what you need to then advise them, if they're going to leave that in there, is to then let any staff know if it's becoming sore or red, so that we can take note.
Now if they decline to have the cannula in, you say that's it, see you later in the treatment?
So we have to look at another way, or we have to persuade them if we feel that it's required. I don't think I've ever really come across someone that has flatly refused one. People with needle phobias, obviously, in the next section are someone you might have to talk around. Taking into account if someone says to you, look, I passed out the last time I had a needle, please don't do it sitting up. Sit them down first. You've got to look at the structure of the patient. Are they a big patient? What's their veins like? There's so many things to take into consideration before you actually stick that needle or even set up your trolley. You need to look at what you're dealing with as a picture. Position the patient so that they're ready. Hand hygiene is so important, as you know, and the sterile field is so important. Right, so it's my turn to set up the trolley for our cannulation. I'm just going to give those ones back to you because I've got some. So, I'm going to go, just clean off Karen's mess for a second. So I've been to I've sort of worked out my risk assessment, I'm going to use an aseptic field because I'm going to put a cannula in. I don't want to give the person a bug. So, do I require it? Okay, so this patient needs antibiotics because they've got pneumonia. So, yeah, they probably do need a cannula. I'm going to go and see the patient. I'm going to have a bit of a chat to him and say, look, mate, you're a bit sick. You need a cannula. Is it okay if I put one in? And he goes, yeah, sure, whatever you like. Have you got any problems with needles? Have you ever, the general conversation. Then I'm going to go and gather my equipment. So I'll go to the storeroom or sometimes the IV trolley, whatever the case may be, depending on what's around on the day, may I say. This will be my dirty bag because I haven't got a paper one today. on the side of my trolley. Not yet though, but I'm going to sit it down here. But that's why the clips are there. I'm going to get my pack, because I want one of these. I'm going to get my water, my syringe, my safety set bun, and a couple of different sizes of cannulas, because I'm not really sure what this patient's veins are like when I go to have a look. I'm not guaranteed that I'll get something nice and clean. I probably should have cleaned the bottom of the trolley, but I did see Karen do that first. Rightio. I like lots of cleaning material. I'm going to go and wash my hands. My hands? Oh, I haven't got a tourniquet today. Sorry. But you can yell at me. I'm okay. Tourniquets didn't come in stores this week, I don't think. So if I stole 8 tourniquets, I might be in big trouble. Because they are single-use items, as you know. Audio. So if I cleaned my trolley, oh, it feels gross actually. It's got a bit of a lump or something on there. Once you clean, just remember that you should not actually touch the top of the trolley. So if you're going to, feet come in very handy. I use my feet all the time. Alrighty, cleaned the trolley, and then I'm going to put it in the bin. Now, most people set up a rubbish bin on the side of the bag, but if you're near a bin, just use the bin. I really don't like stuff on the side of the trolleys because they just increase the risk of infection. Yeah. I'd rather pull a bin out and have it on the floor. Especially if you're just using aseptic technique for a wound, because some of those dressings can be pretty feral. Rightio, I've done my hand hygiene, I've cleaned the trolley. I'm gonna open that packet onto there. So this packet opens slightly different than the last one. It doesn't quite have all the tabs on it that your other dressing pack does. When you open it, it's like a plastic. I'm going to touch this, but you don't. It's very plasticky. So this is quite a nice thing to pull out. This is just like a plastic garbage bag. Fold it in when you drop it. The little tabs, they're not tabs, you're going to go for the corners because there's no tabs on these. So as much as 90% of us probably would have learned with a dressing pack, these are reasonably good. Inside this, however, you actually have a second sterile field that I'm going to touch for a moment. No touching normally. A second sterile field that you can actually use on the patient. So because this is in the packet, it's sterile. Okay? So that's in there as well. I'm just going to fold that back up. Inside the packet, as I explained before, there was 2 things. Your sterile cleaning and your dressing. There is also a sticker to put on it to say when you put the cannula in, which you'll find out is quite important later on, and a couple of gauze swabs. So to set up that field then, you actually need to add in the products that you're going to use. So adding in everything that you need. So if I was to say what should go on top of my sterile field, what would you say? Cannula. Okay. So my cannula. And I open that. And then I just put this inside the packet, checking it that there's not got no holes in it, that it's in good state, obviously. And your cannula goes on without touching the sterile field. And then your rubbish goes in the bin. What else would you specifically put on the top? Yeah. Same thing. Packets in date, in situ. Although we go through so many, I highly doubt we'd ever find one that's out of date. Okay. Obviously not touching the product, and it's now on your sterile field as well. What else? Is there anything else that you put on the top?
10 mil syringe and a 10 mil normal saline.
Okay. Would you put it on your sterile field?
Probably not.
I would. Yeah, I would, because I want to flush it and I want it to be clean.
So if I'm going to take blood out when I put a cannula on, I'll put my sterile 10 mil syringe on there. That's my sterile vial for blood. The problem with this, when we're going to do sterile with your water, because you've got to draw it up, right? Correct? You're not just going to chuck it on there like that.
It's no longer sterile.
How do I draw this up without it not being sterile?
You can't actually touch the syringe and still it's sterile.
You can't actually do it. The trick that I always do is by drawing it up. So this is no longer sterile.
No.
If I put that on there, that's no longer
That's
sterile.
That's the thing.
Okay. So I will draw it up, prep my syringe, all primed ready, but I will actually stick it underneath, sticking off the bottom of the trolley.
Yep.
Because underneath is not sterile.
Yeah.
Therefore, you're not contaminating your actual field. Does that make sense?
Yeah.
So I've got my syringe on there after I cannulate if I want to take blood. That is sterile. I can pick that up and take blood off and that's still sterile. I can wipe, I can put the cannula in, I can put the bung and I can take blood. All sterile. Once the bung's on, you've got a pretty good seal. Once you put that dressing on, you've sealed it. So your dressing's got that plastic, you've sealed. So then you can actually take this because your hands will no longer be sterile.
Sorry, good question. See your colour, your ID colour.
I thought it was a good question.
You've Tegaderm.
Answer yourself.
Well, what? This
Tegaderm.
one? Oh, Tegaderm, yes.
Okay, now that has a date sticker on it, yeah?
It does.
So what's the green one for?
I think it's just part of this particular package that they
Right,
make.
yeah, so it's double handled,
Yeah.
double.
I've actually never used this myself. I use the one on the dressing, but maybe there'll come a time where they put these out that they don't have dates on them. I can't, this is a manufacturer thing. Yeah. Can't actually tell you, that tells you who put it in, but we should be entering that on iView anyway. So realistically, whoopsie, just knocked my 10 mil off. Lucky it's not sterile. Yeah, I've actually never used the green sticker, I always use this, but maybe one day these will come and they won't have a date on them and they're going to make us, or maybe it was they came out to stick in physical notes, like on the paper, but we don't do progress notes anymore. All this should be entered into your iView. So when you put something in, you should enter it. So if that makes perfect sense to you, what we'll do, we'll just divide into groups of 2 and you can go through that procedure yourself. Opening out your packet, talking each other through the process, emptying it on with a no touch. Not touching anything is something that you have to get used to. It's definitely a technique. Do you feel comfortable to do that with each other? No, we don't.
We'll talk you through it.
Unless you're going to get down to sterile gloves.
Yeah, that's what I was going to do.
Really, the
So you remember this is sterile, or it's open gloves. So then we're just going to remember aseptic, it's not completely sterile. We want to keep that as sterile as we can until we got clean gloves on, then we can touch that. You don't want to touch that either until you everything I touch on puts germs, whether it be me, if he does it in my teeth sometimes. So,
I'm just going to, but I do want to say, you know,
Very garbagey, isn't it? Summer and electricity, we're in trouble.
still got to clean. So remember when doing that whole procedure, all we're trying to learn about is actually opening everything onto that package. So that it's sterile. And you will see.
I always use that to put on their arm, so you don't get blood on the sheets.
Maybe that's on TBB.
But that's just me. We're trying to save something.
I'm working within my scope.
I mean, you know, as far as, you know, I know the rules and laws and how they change, but they say to keep a cannula for 72 hours. Now they're saying keep it as long as you can because it stops the person getting more.
Correct.
What is it?
So it is to keep them in as long as you can, you know, because what happens is every time we're removing them at 72 hours, you're increasing the risk of another infection. Every time you stab someone, you're breaking that barrier. So they're saying unless it's red, painful, or showing signs of infection
oh,
to the head,
because I was going to.
or you're not using it, take it out. Like, there's a lot of patients that have them in and you might walk and go, they're not having antibiotics, they're not having antibiotics, get rid of it. Reduce the risk of having infection. So when we do a review on something like a cannula that may have had an infection, because that's an invisible thing within the hospital, so if a patient gets an infection from a cannula that we know of, That's invisible. So that's an in-hospital infection.
You come with that to begin with, yeah? That's why I need to.
So then what we look at is who put it in. In their notes, did you write that you used an aseptic technique while you were putting that cannula in?
You see, it's important.
90% of the time it's never written. So therefore you can automatically go, well, not written, not done. So was the correct procedure done to put that cannula in the first place? And it's all about reducing the infections to the patient, because you're reducing their time in hospital, you're reducing their mental worry because they're here, their dog might be at home by itself that they're stressing about. There's so many bigger things if they get an infection.
Is there a section in the IView that says aseptic technique, you can tick the box?
I think it does.